Hi, today I'm going to present about central nervous system of clonazepam. Prepared for Dr. Muhammad Nazif Samad and presented by me, Elina Nipos. In this topic, we will cover a few subtopics, which is overview of CNS, overview of clonazepam, pharmacokinetic of clonazepam, pharmacodynamic of clonazepam, drug action, and conclusion. So, what is central nervous system? The central nervous system is the primary control center of the body responsible for processing, interpreting, and responding to sensory information. It consists of two main components, which is brain and spinal cord. So, what is clonazepam? Clonazepam is a medication classified as a benzodiazepine, primarily used to treat certain neurological and psychiatric conditions. It's worked by calming the brain and nervous system. So here we go to the pharmacokinetic of clonazepam. There's a 4 point here, which is first is administration. Clonazepam is rapidly and completely absorbed after oral administration. The absolute bioavailability of clonazepam is about 90%. Maximum plasma concentration of clonazepam are reached within 1 to 4 hours after oral administration. 2. Distribution. Clonazepam distribute very rapidly to various organ and body tissue with its preferential uptake by brain structure. The apparent volume of distribution has been documented as approximately 3 liters per kilo. The recorded plasma protein binding of clonazepam range between 82 to 86%. Third, metabolism. Clonazepam is extensively metabolized by the liver cytochrome P450, particularly by CYP3A in a dose-dependent manner. Fourth, extraction. The elimination half-life of clonazepam is around 30 to 40 hours. Clonazepam major metabolite 7-amino clonazepam is extracted mainly in the urine. So here we go to the next subtopic, which is pharmacodynamic of clonazepam. The precise mechanism by which clonazepam exerts its anti-seizure and anti-panic effect is unknown, although it is believed to be related to its ability to enhance the activity of gamma-aminobutyric acid, GABA, the major inhibitory neurotransmitter in the central nervous system. What is the drug action of clonazepam? So, as we know, clonazepam is a benzodiazepine with anxiolytic, anticonvulsant, sedative, and muscle relaxant property. Its action are mediated through its effect on the GABA-A receptor, a critical component in the brain inhibitory signaling. So there's a three main points here, which is GABA receptor modulation, role of clonazepam, and effect of neural network. So here we go to the next subtopic, which is CNS effect of clonazepam. Clonazepam is a benzodiazepine that exerts its effect on the central nervous system by enhancing GABAergic inhibition. This is lead to widespread CNS depression, affecting multiple brain regions and neural function. So there are 6 points in drug effect of clonazepam. The first is sedative and hypnotic effect. It is enhanced GABA receptor activity, leading to suppressed neuronal excitability, causes drowsiness, sedation, and fatigue, can interfere with REM sleep, leading to altered sleep pattern. Anxiolytic anti-anxiety effect. Reduce overactivity in the amygdala and limbic system, which are responsible for fear and anxiety responses. Help in treating panic disorder, generalized anxiety disorder, and social anxiety. Provide a calming effect but may cause emotional blunting with prolonged use. Third point, muscle relaxation. Act on the brainstem and spinal cord, reducing muscle tone. Used for muscle spasm, restless leg syndrome, and spasticity. Can cause weakness and reduce coordination. Fourth, anticonvulsant or anti-seizure effect. Stabilize excitable neural network, preventing excessive firing of neurons. Used in the treatment of epilepsy, absence seizures, and myoclonic seizure. Long-term use may lead to tolerance, requiring higher doses for the same effect. Fifth point, motor function and coordination impairment. Suppresses activity in the cerebellum, leading to dizziness, ataxia, slurred speech, and increase the risk of fall and accident, especially in the elderly. Sixth point, dependence, tolerance, and withdrawal. Chronic use lead to tolerance, requiring higher doses for the same effect. Can cause physical dependence, leading to withdrawal symptoms when stopped suddenly. Withdrawal from long-term use should be done gradually to prevent severe CNS hyperactivity. So here we go to our last subtopic, which is adverse effect and challenges. So there was a few points here, which is sedation and CNS effect, drowsiness, dizziness, and cognitive impairment, cause respiratory depression, especially when combined with other CNS depressants. Tolerance and dependence. Long-term use can lead to tolerance, requiring higher doses for the same effect and dependence. Withdrawal symptoms may include anxiety, agitation, tremor, and in severe cases, seizure. Potential drug interaction, which is increasing the risk of respiratory depression and sedation. It may also interact with medication that affect the liver enzyme responsible for its metabolism. For special population, there are 3 points here, which is first, elderly patient. It increases sensitivity at a higher risk of side effects like sedation, ataxia, and confusion. For pregnant lady, it is classified as a category D drug, indicating potential harm to the fetus, including birth defect and sedation. And for liver and kidney impairment, this condition can affect the metabolism and excretion of clonazepam, necessitating dose adjustment. Summary of what we have learned from clonazepam is first, clonazepam is a therapeutic benefit as significant but carry risk of dependence, tolerance, and adverse effect. Its major classes include analgesic, sedative, and stimulant, enhance GABA activity, reducing nerve excitability, and producing a calming effect. And that's all from me, Elena Nipus, and thank you for hearing me out.